In this case, it was claimed that the errors committed by the doctor during delivery of this child resulted in permanent brain damage. Specifically, the claim was that the brain was injured during the use of a vacuum extractor. Trial Exhibits was asked to create a presentation of an alternate theory to show that the injury of this baby occurred much earlier due to umbilical cord compression during the mother's contractions. The trial exhibit solution was to create a combination of a custom medical animation, a stock medical illustration, and a custom interactive presentation to present all the facts of this case. First, it was necessary to create an animation of fetal oxygenation showing the importance of the umbilical cord in carrying oxygen from the mother and the placenta to the fetus in utero. Next, we showed how the umbilical cord can become entrapped during labor and how the compression of the cord can obstruct blood flow to the baby. Finally, the animation showed the resulting deoxygenation and distress of the baby following the prolonged blockage of blood flow through the cord. In addition to the animation detailing our theory of events in this case, it was essential to present the only actual evidence of the events that occurred within the womb. This evidence was found in the recorded fetal monitoring strips. A fetal monitor is a device placed on the outside of the mother's abdomen that records both the fetal heart rate and the mother's contractions. Regretfully, the fetal monitoring evidence was quite voluminous in this case, and we could not simply print a few of the strips. The trial exhibit solution was an interactive fetal monitoring strip viewer that would allow for an electronic display of the entire collection of strip evidence. This viewer allows for scrolling back and forth through the strips, the placement of annotations and tab lines, and the incorporation of comparative strips showing classic examples of fetal heart patterns. This comprehensive presentation of the evidence, along with our illustrations and animation, helped to make it clear that the injuries in this case occurred long before the vacuum extraction was attempted. In addition to custom solutions, Trial Exhibits also offers over 5,000 stock medical illustrations and animations. Check out our gallery at www.trialex.com.